I had to re-record this because I accidentally had too much content and exceeded the 10-minute time limit on this platform, which to be honest with you, I hate. I feel like genuinely interesting content cannot be constrained within 10 minutes. Like, that's just how it is. We used to rag on Fox News for their soundbite quality reporting, their 2-minute news articles that had horrible journalism. You really can't get a nuanced discussion going in 10 minutes, but I'm going to try here. Let's talk about what it's like to have severe PTSD. This is the shit that you don't hear about when you go to psychology class. Although, to be honest with you, my symptoms aren't exactly rare. Close to 50% of people with PTSD experience what I'm about to talk about today, which is re-experiencing pain during a flashback. So, flashbacks cannot be confused with false memories. A flashback can never be false. Because let me explain to you that a flashback is nothing like remembering something. We remember things that we imagine similarly and with similarly to how we imagine real things. That's because the things that we think about are a part of our normal memory, just like seeing the things outside of our head. So I don't know why people were impressed by that research. It's like, of course, you remember imagining something. Like, obviously, that's going to just be encoded like a normal memory because that was a normal part of your life. So, like, I imagined something at 2 p.m., then I vacuumed at 3 p.m. It's like, those are two different actions, and you're remembering doing both actions. I don't understand why that was revolutionary research. But anyway, so people talk about things like repressed memories and false memories, and they act like this kind of settles a debate on how seriously to take survivors of trauma. It doesn't. You clearly don't understand what it's like to actually have memories come back of a traumatic nature. They come back in the form of flashbacks. You will never, I cannot think vividly like a flashback. During a flashback, your memory turns photographic. And you can have things like you can re-experience severe pain. Like if you were in severe pain when you were traumatized, your flashback can contain a pain component. Mine does. I went through many painful things. I've been raped every which way. I have been tortured with electricity by several different means at several different times in my life. And yes, it's as horrifying as it sounds. I once was stun gunned, this will be triggering, on my vagina during a violent rape, and it triggered childbirth contractions. That's on top of how it felt like that entire area was on fire because of the pain inherent to it. So when I flash back to things like that event, I re-experience the pain. It's the worst pain I've ever felt in my life. It was when it happened, and it still is in the flashback. It hasn't lost an ounce of that pain. So, like I said, something around 40 to 50% of people with PTSD experience pain in their flashbacks. Flashbacks are hyper-vivid, multi-sensory experiences. They're nothing like a schizophrenic's hallucination. Funny thing about those, a schizophrenic's hallucinations can't hurt them. Not beyond, okay, so you know when you like touch something and you get a little static shock? That's as painful as a schizophrenic's hallucinations can ever be. They can never be any more painful than that. It's very, very mild pain. Also, schizophrenic hallucinations won't be able to both be there and then also touch them. That would be called a multimodal hallucination. I used to be a psychologist before I became totally and permanently disabled by getting raped too much. And I'm very salty about it because I was a career-driven person. I'm not one of those stay-at-home homemaker type people. I hate it. I wanted to be a professor with a research lab. But so, people with psychosis have these very simplistic hallucinations that only affect one sense at a time. So they might see something, but they can't touch it. It can't touch them. It never will be able to. Same with their voices. Now, they could feel a very mild sensation. It would feel like a cloth going over your skin. And then they might get a delusional idea attached to it. That's it. PTSD is incredibly distinct from all other mental illnesses, but if you're not trained in understanding how PTSD manifests in the real world, you might get confused. For instance, you might think that hallucinating pain is a schizophrenic's issue. It's not. They don't hallucinate painful stimuli. People with PTSD do, though. It's a unique phenomenon that is unique to PTSD. There is no other illness that causes pain flashbacks. I mean, some people can get nerve pain, but that doesn't come with a flashback. That's just your nerve is physically damaged. This is visible to the naked eye, and it misfires. This isn't like that. This is when you have flashbacks, pain with that flashback from that event comes back in full. See, how am I doing on time? It's really hard to have a nuance discussion in 10 minutes, but I'm going to try. So I experience pain flashbacks, and I live in terror of when the next one's going to hit. I have been knocked out with drugs. I have been abducted. It's all by the same people that trafficked me as a kid and their friends. And it's horrifying. My flashbacks are incredibly severe. I have about 30 years of them. That's right. My last assault happened August of 2022. Less than a year ago. So I live in terror of it happening again. There's no reason to expect that they won't continue their assaults. The pain is so bad. It's the worst pain I've ever felt. I don't just mean during the assaults. When I flash back, it's bad. I don't know if I've mentioned that I've had a kidney stone and I've also had labor contractions before, which are two of the most painful things known to man. My flashbacks are more painful than those. Yeah. They're more painful than the two most painful experiences known to man. And that's what I deal with when I take psychiatric medication, any of them. Mood stabilizers, antidepressants, antipsychotics. I tried everything because of my severe depression and anxiety. They all trigger daily, up to 3 times a day, maybe 3 to 5 times a day, flashbacks. And many of them, I either re-experience the feeling of being drugged, so I get severe vertigo and start vomiting because it recreates the nausea of when I got knocked out, or I actually have the pain, and the pain is so bad, I begin vomiting and can't even stand up because, actually, the pain was so bad one time, I passed out in a puddle of my own vomit in the bathroom. I fucking passed out. Only level 10 pain causes you to literally lose consciousness because the pain is that bad. I also passed out during the actual event that caused that to happen from the pain. So that mirrored what happened during the trauma almost perfectly. So pain flashbacks are horrible. I had to go off all psychiatric medication because they were relentlessly triggering these hyper vivid flashbacks of getting knocked out and abducted and raped at different points in my life over and over and over and over again. I could not deal with that on a daily basis. I fucking couldn't. I ended up in the hospital once because I was so dehydrated from constantly puking. So now I don't have those very often. I'd say I have them a couple times a month now without psychiatric meds. And then I have partial flashbacks on a daily to maybe every 3 days basis. Every now and then I'll have a day where nothing happens, but nothing happens as in like no flashback, but almost every day I have what's called a partial flashback, which is like I see a flash of what happened and I'll get like a shock of pain for like a second, but it doesn't linger or turn into a whole full-blown thing where I get the vertigo from getting drugged again and start vomiting. I really do feel like I'm on drugs when it happens. I don't do drugs. I never have. I'm not that kind of person, but I think I know what they are kind of like. Absolute bullshit because of these flashbacks. They really do recreate the effects of these depressant and hallucinogenic drugs. But that said, I have never heard anything that wasn't there, and I have never seen anything that wasn't there. I am not psychotic, but I do have severe mental illness that can sometimes make me look and act delirious because the flashbacks have taken me so far from reality that I'm not really there anymore for a little bit. I've done some pretty weird and embarrassing things, but that's for another video. So yeah, that's me. I'm a person with complex PTSD. I see very little from people talking honestly about it. I'll see people talking about stuff like going through domestic violence and CSA and stuff, but they don't talk about the hard-hitting shit. They really don't. I don't see a lot of other torture survivors, which is what I've been through. I don't see a lot of other sex trafficking survivors. I don't see a lot of other people who have DID, that's multiple personality disorder, now called dissociative identity disorder. I don't see a lot of that. So, oh shit, I'm about to hit 10 minutes. Take care.